to laugh. I'm not really a morning person. You can ask Allison, who is my hotel roommate. She asked me a question, and I just kind of looked at her and she said, "You need coffee first before you can answer that." I said, "Absolutely." So this is not my best time of day, but I realize it's probably not the best time of day for many of you. So I will try and inject some energy in here to get us started on a great note. I am very sad that Dr. Johnny is not able to join us, even though he's a local here in St. Louis, and we were all set to do this presentation together. He had a death in the family of a young relative. So please keep him and his wife and their family in your prayers on this day of sadness for them. But Dr. Donnie did want me to share a few things about what inspired him in this work. And he spoke of how when he was a young medical student in the 1970s and was learning reproductive physiology through the traditional healthcare curriculum, he learned about the hormones and how to manipulate them, but not necessarily what they meant. And even though at that time Dr. Hilgers was a SLU faculty member, he had no idea about the pioneering work that he was doing in natural family planning and fertility awareness-based methods. And he said, you know, it's a shame because if he had that mentorship then, maybe it would have been different. He's like, maybe not. He's like, I was a pig-headed medical student that, you know, we know everything, so why listen to the older folks? But Peter said, you know, it is important to recognize he did get to where he is today because of mentorship, because of people who have spoken, you know, to him along the way and have mentored him. And he asked me to remind you, you are all mentors. You know, we are all called to go out and share this message. And later in this presentation, I'm going to share about the one person that introduced me to natural family planning and fertility awareness-based methods, because I want to highlight how it can impact the trajectory, not only of your own personal career, but of the movement in general. So one other just housekeeping note, I did pass around a fax sign-in sheet and would ask people, if you're interested in getting information about the work that we're doing in fax, we send out a weekly newsletter with like a research update or a student's interview of patient experiences. We welcome you to do so. So, again, no relevant financial disclosures, although I did make an addition to this because I had to add my sister here. This is my sister, Therese. I'm a board-certified family physician. She is a trauma critical care surgeon, so we've kind of gone to the ends of the medical extreme, and she's there with her husband, Dr. Jeffrey Tessier, who's an infectious disease doctor. My sister lives in Dallas, and a few years ago, I was spending the summer with her, with my 4 kids, and as you can see, they both wear Ironman shirts because they do triathlons, and so being a surgeon, she would get up at like 3 or 4 o'clock in the morning to like run for an hour before she would go to the hospital. And during this summer, she was getting up at 4 and usually saying good morning to me as I was saying good night to her as I was going to bed at 4 o'clock in the morning. And after about 3 nights, she's like, why are you still awake at 4 o'clock in the morning? Like, I'm really starting to get concerned. I'm like, I just have so much work to do. Like, there's all of these things I'm trying to do with fax, and I just don't have the time. She's like, well, you just need to hire somebody to help me. I'm like, well, that's great, but money doesn't grow on trees. And she's like, how much do you need? And I'm like, seriously? So starting then, she actually gave me a monthly donation then so I could hire a part-time person, which was incredible. So I want to recognize her, and we have about a dozen monthly donors that give on a regular basis to fax that without their support, as well as the support of the Chiara Scuro Foundation that's given us a couple of grants, we would not be able to do the work that we do. So I just wanted to publicly recognize her. If family love is a disclosure, there you go. And I should say, as I said yesterday, I'm one of 7, and the CEO of the Family Medicine Education Consortium, Larry Bauer, said to me once, I'm really glad you come from a very big, very generous family, because like the first dozen donations to fax all had the last name Duane on them. So, anyway, all right, so for today's talk, what we'd like to do, or what I will do today, is review the current approaches about how medical schools teach students about family planning and women's health. We're going to talk about medical students' current knowledge, attitudes, and experience with regards to fertility awareness in general. We'll talk about options for learning about these within the accepted medical school curriculum, as well as explore opportunities for students to participate in electives and other experiences, and how you can help train the next generation of medical professionals about fertility awareness-based methods. So as many of you know, can I just see a show of hands, how many are physicians or nurse practitioners or midwives, other medical professionals? So now, keep your hands up. Now keep your hands up if you learned about natural family planning or fertility awareness-based methods in your medical education. Okay. Now keep your hands up if what you learned was actually accurate information based on the up-to-date evidence. Okay? So I just want to know where you went to school. Because this is not taught in medical schools. The way the current approach to fertility awareness or family planning education is it's designed to allow 2 or more adults or adolescents to be able to have sexual contact without consequences, working to minimize the risk for sexually transmitted diseases without regard to normal hormonal function, human life, and human physiology. We heard many of our speakers yesterday talk about, I was trained to view the pill as the panacea for all that ails women. If a woman comes in with irregular cycles, give her the pill. Painful periods, give her the pill. Acne, give her the pill. It's amazing what we use contraception for, birth control for. But what we don't learn is the way the body is designed to function normally, what's physiologically healthy is, and as we talked about yesterday, the importance of the hormonal changes in the female cycle. And in terms of the treatment of medical problems, again, the goal or what we learn is how to suppress the female cycle without getting at the root cause or the etiology. In terms of our experience as physicians and teachers, what patients want is when they have a medical problem, they want to understand what's happening. They don't simply want to take a pill and forget it. And many patients want to collaborate. They want to be an active participant. They don't want to simply be told, take this pill and don't worry about it. Many women and men are interested in learning and understanding what's healthy and how could they work with their body. I mean, Allison pointed out yesterday that the most widely downloaded app is not fertility apps. Remember, that's the second. The most widely downloaded one are fitness trackers. People want to know what's happening with their body. They want to stay healthy. They want to have a safe and effective plan. Nobody wants to take medications with known side effects. I dare say, if you told women before you prescribed the pill, did you know that this is classified as a group 1 carcinogen, the same as tobacco? Would you like to take this to prevent pregnancy? You might have more women second guessing and saying, maybe that's not the best option. And it's important that we want to be able to offer options to our patients that are consistent with their morals and values. So I'll talk about this a little later, but I teach an elective on fertility awareness-based methods, and it's open to everybody. And earlier this year, in September, I had a student from a medical school who was Jewish, who took my course. And as part of the course, we have them shadow physicians, and one of the places where we typically send students is to Tepiak, OB-GYN, and you'll hear from Dr. Buchalski later. And they have a beautiful chapel in the office, and there's crucifixes in every room. And the student said to me, she's like, I'm Jewish. She's like, I was a little bit off-put by all the Catholic in this curriculum. And she said, but I realized, I guess it's important for me to be able to understand and respect their belief system too in providing women's health care. I was like, yes, what a novel idea. Everybody should have a right to receive care that's in accordance with their values. So if you look at the way medical school education and women's health education is designed, APGO, which stands for the Association of Professors of Gynecology and Obstetrics, have developed a list of intended outcomes with instructions in terms of instructional methods like case-based learning, continuing education, individual learning, assessment methods, multiple choice questions, level of competency, and then the ACGME competency. And if you read these outcomes, describe the mechanism and action of contraception methods, counsel the patient regarding benefits and risk for every contraceptive method, including emergency contraception, etc., we can simply substitute in the word fertility awareness-based method and or at least add that in as an additional learning objective. There is no reason why medical students should not learn the mechanism of action of modern fertility awareness-based methods. There's no reason why they should not be learning how to counsel patients about these options or understand the effectiveness and the barriers to uptake. So it should and could be possible to integrate FABM medical education into the traditional medical education curriculum. How do we do that? Well, I will tell you, working with medical students, that classroom lectures are out. I mean, God bless you all for sitting here at 8:30 in the morning listening to me lecture at you, but this is not what people want. They do not want more PowerPoint presentations, especially the younger generation. They want web-based learning. They want to be able to do work before the classroom and really just engage in discussion. They like the idea of role-playing. How do I have this conversation with this patient about this recurrent discharge that she's having month after month? So these are the ways that we need to be thinking about how do we share this information. When we ask students what they think about education and what they're interested in, they are interested in technology. They want to learn when they want. They want the curriculum to be flexible so they can learn when they're interested. They have been conditioned to seek out evidence-based information. They're interested in patient education. How can I take what I'm learning in the classroom setting or online and share this with patients? The beautiful thing about fertility awareness-based methods, and I would love to see more and more medical students be trained to teach fertility awareness-based methods between their first and second year of medical school, is when you're a third-year medical student, you have a lot of time with patients, but you can't write prescriptions. And you can't place medical devices, but you can spend some time sitting down and talking with the patient about her cycle and about her discharge. And so by training students early in how to teach fertility awareness-based methods, we've given them a tool. It's not that I don't do this, it's I can offer this information to patients while my preceptor is busy doing the thing in the next room. Students do want to do what's right for patients. They believe patients have a right to know, but in order for patients to know, students need to understand. They're passionate about learning and patient care when they think it can make a difference. In terms of the challenges, students have different interests and motivations. Again, I'm teaching an elective, and I've had students from all across the country take this elective. Some heard about it through the Catholic Medical Association, some found out about it through Georgetown. Some wanted to take it in their home state, others wanted to come to DC because they wanted to be able to live with their same-sex partner while taking my elective. So it's very interesting. These are people that want to go into OB, want to go into women's health, and they sought out this elective. So they have different interests, and we have to just remember that and meet them where they're at and share the science. When we share the science, it's so much more eye-opening for them. They have different learning styles. They are not necessarily the most confident, but when you teach them how to just do basic instruction, it instills in them a sense of confidence. They don't have mentoring. How many of you have a faculty appointment at any sort of medical or health professional school here? One of the things that I will tell you, whether or not you have an appointment or not, one of the things FACS is seeking to do is to identify people that are willing to mentor students and residents. So if that's something that you're interested in doing, when that sign-up sheet goes around, just put down, I'm interested in potentially being a mentor. Time demands, that's another big thing. We made our elective so it's only 2 weeks so we can get more students engaged in it, and then balancing those personal and professional goals. So the question is, and when it comes to women's health and medical student education, do we try and speak the language of the academic organizations and use their methods, or do we try and make and market something better? In order to answer that, we need to know where we are now. What are medical students learning currently? As we saw, I think it was about a third to a half of you said you learned something about this in medical school. Less than 1% reported learning anything accurate. Dr. Duane and his colleagues at SLU originally did a pilot study where they surveyed fourth-year SLU medical students about their general knowledge of FABMs and their confidence in using this information in patient care. Students reported an average of less than 1 hour of teaching about FABMs across all 4 years of medical school here at SLU. Half of the students did not feel comfortable providing this information to patients, and none felt that they were confident in using FABM charts to address women's health issues. The good news is that students are interested. At FACS, we did a survey of medical students at 7 different medical schools across the country. We had a number of students participate in this, Dr. Kara Buskmiller, Dr. Ashley Stone, Dr. Cecilia Jola. Many of these people may look familiar to you. And what we discovered is when we surveyed students, 85% said they agree physicians should have adequate knowledge about FABMs to offer them to patients. So they know this is information that they need. 60 to 70% wanted to learn about them, with 2/3 interested in online learning opportunities. 80 to 90% though said they were not familiar with any of the modern evidence-based methods, and if they had heard of any method, it was the rhythm method. Which again, if we're priding ourselves on evidence-based education, we shouldn't be talking about the method that was developed 80 to 90 years ago. We need to be talking about the methods that have been developed and continue to be refined in the last 20 to 40 years. So, why is formal education about these methods necessary? Well, again, even though less than 1% of women in the United States use fertility awareness-based methods, when they're offered this information, many say they do want to learn it, but they don't get advice from their medical professionals. There was a study that was done in Canada, specifically of obstetrician gynecologists and family physicians, and what they found is only 3 to 6% had correct knowledge about the effectiveness of modern FABMs. This is shocking. I mean, these are the doctors that provide women's health care. And numerous studies show the method that most medical professionals report that they're familiar with, again, is the calendar rhythm method. So I recently gave a presentation at the Humani Vitae conference in DC in April, and in doing that, what I did was I looked at all of the literature about what is taught in medical education, and from 1982 to 2016. And what I found is the study showed overwhelming majority of physicians and nurses receive limited education. Less than half report they knew this well. Residency faculty residents don't feel confident. Medical professionals will not offer NFP as a viable option. So at SLU, what Dr. Duane wanted to do was, if we offered 2 lectures on fertility awareness-based methods, both from a family planning perspective as well as a medical surgical applications, and provided additional resources, would this impact students' comfort level and confidence level with offering this information to patients? And they thought their knowledge should improve, their confidence should improve, both in offering the methods as well as using it to address women's health problems. So Dr. Johnny gave one lecture, Dr. Young, who presented yesterday, gave the other lecture. They did a pre-test and a post-test, and they did this for 2 years. And what they discovered was that prior to the intervention, the majority of students felt very uncomfortable in terms of sharing this information. The number that felt, the comfort level actually doubled by the end of the study. Same thing in terms of confidence level in utilizing these methods to diagnose and treat. Again, they felt very uncomfortable, but by the end, more felt confident to very confident. So this article is published in the Frontiers of Medicine, so if you're interested in reading that, please do so. So now I said I wanted to share, this is where I was supposed to take over, so that was Dr. Duane's talk. I'm going to share a little bit about what inspired me. This woman, her name is Dr. Pearl Huang Ramirez. I met Pearl when I was a first-year resident at Lancaster General Hospital. She was one of my senior residents, and one night, and I mentioned this story to a few people yesterday, when I was on OB call as an intern, I did what any good intern would do on OB call, and I was sitting there getting my discharge paperwork ready for my postpartum patients. And one of the most important things that we did was write the prescription for birth control, because it was drilled into you, do not let a woman leave the hospital with a baby without birth control on board. That's literally the message that we got. And so I'm sitting here thinking I'm being a very good resident, writing the order for the depot shot and the prescription for the birth control pill. And Pearl, who is one of the sweetest, quietest, most introverted people in the world, says to me as my senior resident, she first opened the conversation like, well, let's talk about, birth control and the indications and the side effects and, whether or not this might be the right choice for these patients, gently trying to share the science with me. And then she said, after we had those conversations, I was like, well, we were talking about the side effects. And she said, well, there are some forms of family planning that have no medical side effects. And I looked at her, I'm like, well, no, every form of family planning has some side effects. I mean, even the condoms, they all have side effects. And she's like, no, there's actually one class of family planning methods that have no medical side effects. I said, what is that? And she said, well, natural family planning, where women learn how to chart their cycle or observe their signs to be able to identify when they're fertile and when they're not. And I looked at her, and I had no clue. I am a 29-year-old woman in my family medicine residency, passionate about women's health. I had personally been put on the pill in college because of, painful periods, because that's what they said that I needed to do. I stopped when I started losing clumps of hair, that I had bald spots, and called the student health, and they were like, oh, that's normal. I'm like, I've got the bald spot the size of a baseball on my head. That can't be normal. And they're like, oh, well, we'll send you to dermatology. They can probably do some steroid injections. I'm thinking, really? This just didn't make sense. At that point, I had no other idea. This was 7 years prior to my encounter with Pearl. So I just want to emphasize the importance of that personal encounter. That night changed my life. It changed the trajectory of my career. I would not be standing before you today if Pearl had not, in her own quiet way, shared the truth with me. A few years later, that was in the summer, fall of 2000. 10 years later, I had been on the faculty at Georgetown. I joined the faculty in 2004, ran their clerkship, was very much in the closet. Nobody knew that I was passionate about fertility awareness. I didn't dare come out to my fellow colleagues at Georgetown about that. And then in 2008, my last year at Georgetown, I had been offered a medical director position with Catholic Charities Health Center, so I was going to be leaving Georgetown, but I had all of this CME money. So I'm like, okay, now's the time to go to my chair and say, I'd like to use that to do my crate and napper training. And I was able to do it. But then in 2010, one of my colleagues at Georgetown, I was still volunteering as faculty, reached out to me and said, you know, we're looking for people to teach a small group elective on any topic loosely related to medicine. Like, their goal is to offer students the opportunity to become more well-rounded. And I was familiar with this. I had actually taught one of these courses on breastfeeding called Breastfeeding the Basics and Beyond, because that's another topic that we're sorely lacking in education. My husband, Dr. Kenny Lynn, who's also a family physician, and a huge Civil War history buff. I don't get it. He's the only Asian guy that goes to these Civil War sites. It's quite hysterical. He is not a reenactor, though. That would look really weird. But he and I had taught one on Civil War medicine and how the Civil War laid the foundation for surgery and triage and the development of the nursing profession. So when they reached out to me, I thought this would be such an incredible opportunity, even to reach a small group of first-year medical students and teach them the science of natural family planning. And I thought, this is such a fabulous idea, and I should totally do this. And then the rational part of my brain kicked in. Like, you're a medical director running 2 medical clinics, 2 dental clinics, you have a 3-year-old and a 1-year-old. With what free time are you going to create an 8-week course? So I deleted the email. And it kind of moved on with the stack of other emails in my inbox. And a week later, I got another email. And I was just about to hit that delete button again. And have you ever had that experience where you're just about to do something and you just can't? And I remember throwing my hands up in the air and praying, okay, God, you know that I'm a workaholic. Clearly, all of you do too, because I told you about staying up till 4 in the morning. But I said, you know I'm a workaholic. Help me. I need to know, are you calling me to do this? Or is this the devil just trying to, further wrap me up in my workaholic tendencies? Because my husband, so wise he is, said to me once, you can say yes to whatever you want to say yes to. But remember, every time you say yes to something, you're saying no to something else. He's like, and that's usually your family. I'm like, So I prayed about this, and I said, well, if I'm going to do this, I'm going to need help. So I sent an email out to people to say, in the area that I knew were interested in, I have this opportunity to teach this class. I would need help. Is anybody interested in helping me? Long story short, I had 9 students sign up for the class, which was the most, they typically allowed 6 to 10 students. I had 12 people teaching this course. So when I say I taught a course, better to say I coordinated a course. Dr. Hannah Klaus came in and spoke about Billings and Teen Star. Dr. Richard Faring flew in from Marquette to speak about the Marquette method. Dr. Mike Manhart flew in from Ohio, or drove in, Mike, I think, to speak about syntothermal method. Dr. Svekovich and Dr. White would speak about Creighton and NAPRO. So it was incredible. But the best part was what the students said. This is fundamental women's reproductive health information. Why isn't this a part of our reproductive health curriculum? This is the best class I've had at Georgetown so far. This is something every medical student should learn. And I'm like, they're right. This is something every medical student should learn. But I only have access to the students at Georgetown, and even then, Georgetown doesn't pay me to do this, but how do I reach them? And so what I did was I partnered with Dr. Motley under the umbrella of the Family Medicine Education Consortium, and we formed FACTS. And that is our mission, to educate every medical student, nursing student, PA student, midwifery student, pharmacy student, any student that's interested in learning the science of these methods, as well as residents. So we started teaching this elective 2010, 11, and 12. It was in person in 2014. Then I was like, Dr. Klaus is not going to be around forever, and Dr. Faring can't, Georgetown wasn't paying me, so I said to Richard, I'm like, I can't pay you to fly in to teach this course. I'm like, at the best, I might be able to cover your parking. And I'm like, I can't keep asking these people to give of their time, so I was able to raise a little bit of money in 2014 to have all the lectures professionally videotaped, and then in 2015, we started offering it online. And we actually looked. All the students had the same materials and the same readings. They took the same pre-test and final. And we looked at, did it make a difference? And what we found is whether the students took the course in person or online, all the students showed statistically significant increases in scores. It was a little bit better for the in-person class, and I think it was because we had panels where they actually got to hear from physicians in practice. There was, again, no statistically significant in their baseline scores. They all pretty much were terrible, about 50% or less, but they were significantly better by the end. So It's great to be able to teach an 8-week course at a medical school. It's really not realistic, though, to teach it across the country. So one of the things that FACS has done, we developed an overview presentation, which is an introduction to the science. And we gave this presentation between 2015 and 2017 about 20 to 30 times, and we actually looked at the evaluation forms, the ones that you all signed out yesterday. And what we found is prior knowledge for residents and students before this was primarily fair or limited. Most students really didn't know much, but they said the presentation met their needs. So that was impressive. So how is this research relevant to your practice? As we noted, many of you are involved in teaching students. Medical student knowledge and confidence with applying these is not where it should be, but it can be improved, and you can help with that. Having a baseline knowledge of what's currently offered in medical schools is important. I will say in my experience, almost all medical schools do not teach about this. On that note, FACS is currently doing a research study. Again, remember I said yesterday I'm not really a researcher? I'm really not. I'm a reluctant researcher, but we need to document the need. So we're doing a study at medical schools to document what is currently being taught about reproductive health. Not just looking at fertility awareness-based methods, but all topics, to be able to document that this is a significant gap. And just as a reminder to all of you, who we train today are the future physicians of our country. So when we're facing, concerns of end-of-life issues, and not just in the world of family planning, but if we're not training these students now, what I have found is that you have students that are interested in these topics, but they're terrified to go into OB because they're terrified about being bullied. It's so much easier to go into a safe specialty, but we need to encourage them and support them. So even if after we give them the student accurate information about FABMs, they're still facing challenges because they'll have faculty members that tell them these methods are not effective. The culture tells them patients don't want this, they want something that's quick and easy. Faculty will tell them patients can't learn to manage this, they're not smart, they don't have the resources. Most of my clinical work in Washington, D.C. has been with the poor, uninsured, minority, non-English speaking populations. And I find it so incredibly insulting to say they're not smart enough. That is so unfair. And in fact, if you actually look at the effectiveness studies, especially with Billings, most of those were done in illiterate, ignorant, quote unquote, populations. And they had the higher effectiveness rates in some instances. And when my colleagues make that statement, I challenge them. I say, so what do you do with your diabetics? Do you just insert an insulin pump in all of them because they can't possibly learn to change their diet or administer their medications? No, you spend more time teaching them. So it really, really frustrates me. But we can use these students and their interests to help them help their patients, and we can make more progress by leveraging their involvement. So what are the potential opportunities? If you are faculty at medical school or in residency program, and there are a number of physicians trained in NAPRA that are teaching at medical schools, we need to be open about that. I mean, like I said, I was very much in the closet. 2 years ago at the Catholic Medical Association meeting, I reconnected with a woman who is a physician now in Med Peds. She was a medical student at Georgetown. She's like, I had no idea that she said to me, she's like, I had no idea you were a safe space for me. She felt very alone and isolated at Georgetown too, so I was like, oh, I probably should have been a little bit more out then, because there are students. I talk about the experience I had. I was invited once to give a 1-hour lecture in the human sexuality course at Georgetown on fertility and infertility. It was an auditorium like this, except it was much bigger. There were 200 people there. And I spoke about fertility and infertility, and I described fertility awareness-based methods, and I talked about infertility and traditional approaches to treatment and artificial reproductive technologies. And I described very methodically what is a selective reduction, and just, it's a very benign term, but let me describe to you how this works. You could have heard a pin drop in that room. The course director was livid. You could see, and it's funny because I was 8 months pregnant at the time. And I was very hormonal. I'm feeling my stress. I was so nervous. And the course director interrupted me. She was like, it's not artificial reproductive technology, it's assistive. I'm like, we can debate the semantics, but there's nothing natural about this. And you're not actually assisting a woman in getting pregnant. You are getting her pregnant, and you're not fixing the problem. I'm literally having a debate with the course director in front of all of these students. Afterwards, she told them all to ignore everything I had said, that none of it would be on the test. She was deeply apologetic that she had not vetted me more thoroughly before allowing me to speak to her class. So that was a little discouraging. But the good news was that I had students come up to me afterwards. Well, it wasn't good and not so good. I had students at the end of their second year at Georgetown say to me, I came to Georgetown because I thought that it was a Catholic medical school. And you're the first professor in 2 years that publicly stated that life begins at conception. And I was like, oh, that's heartbreaking. That was terrifying for me. I don't like it. I enjoy public speaking. I was nauseated, literally and physically. But if you have the opportunity, get up and speak, because there are students in that audience that you're going to impact. And you may not know that day, but you may have an impact. There are a number of physicians who have learned FABMs as a method of family planning themselves, and they can share this information. There are a number of medical professionals that teach FABMs. You know, one of the things that we did as part of my elective, students had the option to learn how to chart their cycle. So they could learn, I had an instructor come in and teach them over the 8 weeks they were able to chart their cycle, and they had to basically weekly make observations about their experience. Now, many of these women were actually on birth control at the time, and they said, well, can I still chart my cycle if I'm on birth control? And I would explain, well, if you're on hormonal birth control, it's absolutely going to affect the observations that you'll make, but you can still learn the habit of what is it like to pay attention to the sensation. If you have any discharge, make that observation, just so they could see, this isn't rocket science. This is simple. People could learn to do this. And it was fascinating, because you would see women on hormonal birth control have no signs. You would see women on copper IUDs still have that fertile cervical fluid. They're like, oh, so that meant I ovulated then, right? I'm like, yes, you likely ovulated then. You know, starting to plant the seeds so they can understand the impact of how this is working. In order to do what we do, though, we need to know who are the FABM trained medical professionals. I mentioned, or Joe actually mentioned yesterday, we're doing a study of a shared decision-making tool that we've developed. In order to do the shared decision-making tool study, we needed to identify physicians and medical professionals in the United States who are actually at least familiar with fertility awareness-based methods. We weren't even trying to identify those that are trained, but at least are not hostile, would consider having these conversations with patients. So we searched the internet, went to all of the NFP organizations, sent emails to the director saying we need a list of medical professionals. After all of that, there were 600 medical professionals in the United States that we could identify were either trained or familiar with fertility awareness-based methods. And this isn't just doctors. Again, this is nurse practitioners, midwives. 600. How many people live in the United States? 300 million? We talk about access issues. I mean, the other side is all up in arms that women don't have access to abortion and abortion providers. I would dare say their access to providers of fertility awareness-based methods is even more stark. Of those 600 physicians, as we've been doing this study and contacting medical professionals to participate in the study, so many of them identify as NFP only, and they were listed on the One Where Soul website, but they're a pathologist, or they work at the VA and they don't actually do women's health. So we've already had 250 decline participation in our study, and we're up to about 30 that have accepted. So again, we need a database. There is the One More Soul database that is not necessarily kept up to date, and it is limited to NFP only physicians. I would say there are medical professionals that are interested in fertility awareness-based methods, but that are not NFP only, and I think we need to identify those too. So one of the goals, if FACS can get the funding, we would like to do this year next year is to develop a database where we list medical professionals, where they're located, the methods that they're trained in and or comfortable offering to patients, so that people can be able to find these medical professionals and access them. So that's one of our goals. We need to get into the medical school curricula and the nursing school curricula. The first or second year reproductive physiology class is a great opportunity because you're talking about the basic science of how the female system works. The students that took my selective this year had just finished their repro curriculum. They're like, I just learned so much more in this class than I just did in my last month of repro, because what we did is we talked about the applicability, what this means. What does the cervical fluid mean? What does the rise in basal body temperature mean? We made those connections for them. Third year clerkships are another opportunity, whether it's in OB or family medicine. The reality is many medical students do not learn anything about these methods on their rotations because time is limited, and frankly, most faculty are not trained or knowledgeable. I spoke with somebody who's the third year clerkship director at our medical school yesterday, and she's like, how do I get trained to give your talk? And I'm like, that's a great idea. We're doing a training in a couple weeks. It's kind of a little late, but we'll probably do a speaker training next year. So if you're a faculty member and want to be trained, we have one of our speakers, Dr. Cheryl Beard's faculty at Wichita, Kansas, and she gives our talk every month to the students that rotate with her. God bless her. I'm like, I'm so tired of giving this talk, but you give it every month to the students. So part of FACS's goal is to be able to develop the resources to make it easier for you all to do this. Fourth year elective courses in clinical years can provide opportunities for students to learn the basics as well as observe physicians in practice, and I'll talk about this in just a minute, what FACS offers. We have a 2-week online elective. I actually got this approved through Georgetown Medical School as an official elective. I had to go back before the Committee on Medical Education 3 times. They insisted on seeing the entire course, all of the videos, all of the readings before they would consider approving it. I thought to myself, do you make any other faculty member give you the full course before you'll even consider accepting it? I think they were looking for a way to not accept it, but they didn't realize who they were dealing with in terms of my stubbornness. I'm like, here you go, here's all 10 videos, have fun watching them. Maybe you'll learn something. But we offer this course. It is mostly online, but you can help. If you offer these methods in practice, what we like to offer the students is the opportunity to observe physicians using these methods and observe educators. So if you teach the Creighton method or you teach the Billings method, especially if you do it online, Allison, who spoke with me yesterday, she's been a regular contributor. Students will observe her having these conversations with clients, how to educate them. Why do we do this? We want them to see that this is real, that real women use these methods for a whole variety of reasons. This isn't just some theoretical. So this is our elective. People can enroll for it directly through our website. We do charge a fee of $200. Why is that? So even though I offer it through Georgetown, again, Georgetown will not pay me to do it. They'll charge the students $100 to apply through Georgetown, but they don't pass any of that funding to us. So we do charge $200 so we can pay for a staff member to try and coordinate all of the clinical observation opportunities. It's a great way to reach people that would never in a million years find this via Creighton or Marquette. You know, they've been so conditioned. But like I said, I mean, I've had a few students that are planning on going into OB and are very interested in OB and women's health, and the way we present it is in sharing the science, and it's been very effective in terms of opening up their eyes. So FACS, you've heard about it. We've got a lot of programs. Our speaker program, if you're interested, please make that a note on your on the sign-in sheet or stop by our booth. We have an ambassador program for students and residents. We expanded it this year. The ambassador program meets once a month. It's the second Monday of every month at 8:30 p.m. via Zoom. So we've got students all across the country. It's really an opportunity for the students and residents to not feel so alone and isolated, and to be able to provide them more information. So this past call, we actually had current residents speak about their experience applying for residency. How do you introduce the concept or the question of, I'm interested in fertility awareness-based methods, to learn more about the opportunities there. We bring in guest speakers, so if you're passionate about an area of fertility awareness-based methods and want to speak to our student and resident ambassadors, let us know. We're doing conferences. I mentioned we're doing we already have scheduled 2 one-day conferences next year, February 23rd in Cleveland, April 5th in Indiana, right before the APLOG and ACP meeting. We've got a lot of research. We've got, like I said, the medical school curricula. We did our student interest study. We did a patient experiences survey, which is fascinating. We asked patients about their experience discussing fertility awareness-based methods with their doctors. It's sad how many women said, my doctor laughed at me. My doctor handed me a prescription for the birth control pill even after I told them I didn't want it. We're in the process of analyzing that data. I think one of the things that was interesting to note is the majority of patients did not have access to an FABM-trained physician that was within 2 hours of where they lived. So we really need to be doing more. We're also doing research on residency programs and how FABM-friendly they are. So there's lots that we can do. So if you want to participate in the research, donate to support the research, that would be fantastic. What about other learners? We are not exclusive to the medical students only. I'm very passionate about reaching out to the nurses and the PAs and the midwives. honestly, because especially within the nursing community, you do a lot more in terms of the education. You have more time. And I want to build a network of support. So if you have connections with nursing schools or PA schools and can bring in one of our FACS speakers, let us know. I should say all of our medical presentations are approved for continuing medical education credit through the American Academy of Family Physicians. In addition to what FACS is doing, obviously, I like to tell people we're the appetizer. Our goal is to reach the completely ignorant or the misinformed or the slightly antagonistic and just get them to be open to fertility awareness, and then refer them to programs like Marquette, which is really geared towards the nursing community. They also have online education, which is fantastic and can be done now on a more flexible schedule. Creighton, obviously, super exciting to hear they have almost 100 people participating in their EP2 session starting today. This is an incredible opportunity if you have the time and the money to do this. It's really well done and gives you so much information to, what I say, really apply this clinically. You know, through FACS, I don't expect somebody coming out of a FACS presentation and now knowing how to do supplemental progesterone to address, you know, potential recurrent miscarriages. You need to do a Creighton training for that. There's other newer ones. FEM has recently started up in the last 2 years, and then, as Allison pointed out, you know, it's nice in that they've got all these protocols. They don't quite have the research yet, and that's something that really needs to happen. But for some people, if you don't have the 2 weeks to do the Creighton training, the FEM training is 3 days. Either way, and I will say I've done both of the trainings, neither one is enough. I mean, what you really need is support. I mean, one of the biggest benefits to me in this is being able to work with folks like Ann Nolte when I've got a patient question and they've got like a bi-weekly call to call in and like discuss patient cases. So, but FEM is available. BOMA sometimes will offer training specifically for physicians, as does SymptoPro, which is a symptothermal method. Again, these are probably more introductory opportunities to learn more. So what can you do? One-on-one mentoring is very, very valuable. Don't ever underestimate the power of one. And when you do, think of Pearl. Pearl still laughs to this day. She's like, I don't remember that night on call. I'm like, well, clearly it had a big impact on me. And I made Pearl become a speaker because I'm like, this is all happening because of you. We actually lobbied the American Academy of Family Physicians at their medical conference to ask them to integrate fertility awareness-based method education as one of the curricular requirements. Sponsor students. You know, one of the things that FACS did a couple years ago is we sponsored a symptothermal training. The St. Augustine Foundation provided us funding so we could have 4 medical students go through and get trained to teach the symptothermal method. Again, giving them tools, giving them power. You know, the NAPRA training is fantastic, but it's really cost prohibitive for students. So if that's something that you can sponsor, that would be fantastic. Sponsor students and residents to come to our annual meeting. FACS has our annual meeting on Friday, November 9th in Westchester, New York. It's really, again, a great way for them to learn, be exposed, and feel connected. Volunteer, become a faculty member, you know, apply for an adjunct. Most schools won't pay you, I've learned, but it's still very valuable. I continue my affiliation with Georgetown because I know having that title after my name, even though there's no salary that goes with it, has an impact when I'm speaking. Offer to give a lecture in schools, be a small group facilitator, or part of a group that writes curriculum competencies. Work on establishing those relationships. So what else can you do? Support research. I think Joe and I mentioned that yesterday. For the avid researchers of the audience and the reluctant researchers, none of the research is going to happen without funding. So if you're connected to foundations or organizations, I was pleasantly surprised by an email I got yesterday from one of our speakers who's like, you know, I have a foundation in my husband's name. I'd like to make a donation. I was like, great, that's fabulous. Take time to publish. Write about this, it's really important, and support organizations like the International Institute for Restorative and Reproductive Medicine, FACS, and the Pope Paul VI Institute. So the answer is, we do want to try and speak the language of academic organizations, but we also want to try and make it and market something even better. I'll conclude by saying this. One of the key things that struck me about Humanae Vitae was one of the final comments where he spoke of by pooling our efforts. I truly believe, and I said this to somebody yesterday, the pill came out in 1960, the Billings method was developed in the 60s. Why is it that 99% of women have used the pill, but less than 1% of women have used the Billings method? Or any fertility awareness-based method for that matter. And I think the problem is for so long we have been fighting one another. And what we really need to do is we need to work together. You know, FACS at our foundation is seeking to educate the students, residents, and medical professionals, but we can't do any of that without every single one of you. You know, without the folks that teach Marquette and the IRM and Billings and Couple to Couple League and SymptoPro and Natural Womanhood. We need to work together. I tell people, we're living in a two-person tent. We need to not direct our fire inwards at one another and say, my method is better than your method, da-da-da-da-da. They're all better than the conventional forms of birth control that are out there. So let's focus our efforts on addressing that. So I'll leave you with this. What, if anything, will you do differently as a physician, a practitioner, a teacher? What has this inspired you to do? Think about it. If you're so inspired and moved and want to get more involved in facts, email me at drduane@factsaboutfertility.org. I would love to know. And I just really do want to recognize my husband, because when I quit my job in 2012, he supported me. He supported me 100% of the way. He is not so super passionate about this. In fact, he's like, can you just stop talking about sex all the time? All you do is talk about it. But it's just, I think it's a reflection of the beauty of marital love. And to my 4 children who have been incredibly supportive, my oldest Isaac was in 2nd grade when his teacher sent an email saying, like, kids, we're talking about human biology, and these are some questions that the kids are coming up with, and they all had to be like, how are babies made? Where do babies come from? How do babies come out? Blah, blah, blah. So I emailed her back. I'm like, I'm a doctor. I can come in and answer some of those questions for your students. Which I'm like, this is going to be a great way to teach them about life beginning at conception and passing around that 12-week model. And I talked to him about, like, what is the part of the baby that, I said, everybody has a mom and a dad, which, is honestly a little shocking at my kid's school, because my 6-year-old came home, Mommy, there's a kid in my class that has 2 dads. I'm like, no. They have a dad and a mom. It's very difficult. But I said, what the part that comes from the mom, and a few kids said the egg. I'm like, and what is the part that comes from the dad? And there's silence. And then there's my son. It's the sperm. I'm like, true child of a doctor. But this is my beautiful family, and I'm incredibly grateful to them, and especially to my husband for all their support. So thank you.